What I'm about to show you could completely change the way you think about every blood pressure number you've trusted at home. And when I reveal the mistake that quietly pushes some seniors into unnecessary medication, dizziness, fear, and even emergency room visits, you're going to understand why so many readings that look official on a screen are, not telling the full truth. Please subscribe today for clear senior health guidance that protects your heart, sharpens your decisions, and could save your life. I'm Dr. William Elliott, and I need you to stay with me because this is one of the most important conversations we can have about your health. High blood pressure is often called the silent killer, but inaccurate blood pressure measurement is the silent saboteur. It makes good numbers look bad, bad numbers look normal, and ordinary mornings turn into episodes of panic that should never have happened in the first place. I've spent years caring for older adults who were doing what they believed was the responsible thing. They bought the monitor, they checked faithfully, they wrote the numbers down, they followed instructions as best they could. And still, the data they were collecting was misleading them. Not because they were careless, not because the machine was defective, but because a handful of very common mistakes can distort a reading enough to change treatment decisions in ways that genuinely affect your safety. By the end of this video, you'll know the 7 blood pressure mistakes every senior must avoid. But more importantly, you're going to understand why these mistakes happen, what they do to the numbers, and how to fix them immediately. And I need to warn you right now, mistake number 1 seems so small, so harmless, that most people dismiss it instantly. That is exactly why it causes so much trouble. Before we get to number 7, let me tell you about Eleanor, because her story shows how fast a simple routine can drift into dangerous confusion. Eleanor was 72, careful, organized, and deeply committed to staying healthy. Every morning she checked her pressure before breakfast. For months, her numbers looked stable enough that she felt reassured. Then suddenly, over the course of 1 week, everything changed. Her readings jumped. 158, 164, 161. She thought her heart was failing her. She called her daughter in tears. She considered going straight to the emergency room. She started wondering whether her medication had stopped working overnight. But when we walked through her routine step by step, the explanation had nothing to do with a new disease. Eleanor had simply started measuring after walking up and down the hallway, feeding the dog, and carrying laundry back from the dryer. Light activity, yes, but enough, to keep her body from being at true rest when the cuff inflated. That's mistake number 7, taking your blood pressure before your body has settled. Even gentle activity changes your circulation. Your heart rate rises, your muscles demand more blood flow, your nervous system stays slightly activated. And if you check your pressure in that state, you are not measuring your resting blood pressure. You're measuring an in-between number, a temporary number, a number that may look alarming but doesn't reflect your true baseline. That difference can be large enough to scare you and confuse your doctor. This is why the rest period matters so much. You need at least 5 quiet minutes before measuring. Not 5 minutes while folding towels. Not 5 minutes while talking on the phone. Not 5 minutes while reading upsetting headlines. I mean real rest. Sit down. Let your shoulders drop. Put both feet on the floor. Breathe normally. Give your cardiovascular system time to come back to neutral. Without that reset, the reading starts off compromised before the cuff even tightens. And here's the part that troubles me most. Eleanor's high numbers were not only frightening her, they were beginning to influence treatment decisions. She was 1 medication adjustment away from being overtreated. If we had increased her dose based on numbers taken after activity, her true resting pressure could have fallen too low. That means dizziness, weakness, falls, and for seniors, falls are never a small issue. They can change independence, mobility, and confidence in a single afternoon. And I want to pause here for a moment because seniors face a special kind of risk when these readings are wrong. A younger person may feel a little lightheaded and brush it off. An older adult may stand up, lose balance, and hit the floor. A medication increase based on faulty numbers can ripple into weakness, unsteadiness, confusion, and lost confidence. So this video is not really about chasing perfect numbers. It's about protecting your independence. It's about making sure the information guiding your treatment is honest, usable, and worthy of the trust you're placing in it. every single day. Now, if that surprised you, mistake number 6 is going to surprise you even more because it feels unrelated to blood pressure, and yet it can throw the reading off dramatically. Let me tell you about Walter. Walter was 78, precise, practical, and convinced he had developed severe morning hypertension. His home readings kept running high first thing after waking. He thought something terrible was building while he slept. He imagined silent strokes, hidden heart damage, and all the worst possibilities, before he had even finished his first cup of coffee. When I asked Walter to describe his exact routine, one detail changed everything. He woke up, sat at the edge of the bed, strapped on the cuff, and measured immediately before going to the bathroom. The problem wasn't mysterious at all. It was his bladder. That's mistake number 6, checking your blood pressure with a full bladder. I know that sounds almost ridiculous, but the body interprets bladder fullness as a physical stress signal. That discomfort can stimulate the nervous system and push the reading upward significantly. A lot of people never connect those dots because a full bladder doesn't feel dramatic. It just feels mildly uncomfortable, maybe even normal if you've just woken up. But mild discomfort still affects the body. For some seniors, it affects it a lot. Walter started emptying his bladder before every reading, then sitting quietly for 5 minutes. His numbers dropped back into a much more believable range almost immediately. Same monitor, same chair, same arm. Very different result, because one overlooked detail finally got corrected. So if you remember nothing else from this section, remember this: bathroom first, blood pressure second. It sounds simple because it is simple, but simple things often create the biggest errors when they become part of a rushed habit. And rushed habits are exactly what home monitoring tends to become. You do it every day. You stop thinking about it. The routine becomes automatic. Then one small shortcut quietly becomes your exhausting new normal, and suddenly your logbook is recording stress responses instead of useful medical information. Now let's move to mistake number 5, because this one is incredibly common, and frankly, people defend it all the time. They say, "Doctor, I was only talking a little," or "I just answered one quick question," or "I turned my head for a second and adjusted myself." But blood pressure measurement is more sensitive than most people realize. Mistake number 5 is talking, shifting, or fidgeting while the reading is being taken. And yes, even small movements can matter more than you think. Let me tell you about Carol. Every evening at 7 o'clock, she called her sister, and during that conversation, she took her blood pressure. It felt efficient. It felt harmless. It even felt comforting because she was relaxed and speaking to someone she loved. But her evening numbers were consistently much higher than her morning numbers. She assumed her pressure just rose later in the day. What she didn't realize was that the conversation itself, the speaking, the listening, the reacting, was helping elevate the measurement. When you talk, your breathing changes. Tiny muscles in your chest, neck, and abdomen engage. Your attention shifts. Your nervous system becomes active in subtle ways. Add movement, reaching for a pen, adjusting the cuff, crossing an ankle, turning your torso, and the machine is trying to interpret pressure changes in an environment that is no longer quiet or stable. The device still gives you a number, of course. That's what makes this so deceptive. It doesn't announce, "Warning, your technique just corrupted the result." Carol stopped talking during the measurement. She sat quietly, took 2 readings 1 minute apart, and wrote them down afterward instead of during the inflation cycle. Almost immediately, her evening readings looked far more consistent with the rest of her week. This is one of those mistakes that creates a false pattern. People start believing they have a dangerous evening spike, or a morning surge, or a medication failure, when what they really have is a technique problem happening at the same time every day. So when the cuff starts, think statue. No talking, no television commentary, no answering your spouse, no checking a text, no reaching for your glasses. Sit still and let the machine do its job. That quiet minute matters. It protects the integrity of the measurement. And if you're someone who gets nervous while waiting for the numbers, just breathe gently and keep your eyes soft. You do not need to perform for the cuff. You just need to stay still long enough for it to listen accurately. Now, mistake number 4 is one that causes enormous confusion because it makes people blame the monitor when the monitor often isn't the main problem. Let me tell you about James. James bought 3 different home devices over 2 years because he was convinced every one of them was defective. At home, he measured low. In clinic, he measured higher. He thought somebody had to be wrong. So I asked him to show me exactly how he checked at home. The moment he demonstrated it, the answer became obvious. James sat in a soft chair and let his cuffed arm hang low beside him. Sometimes he rested it in his lap. Other times he held it halfway up in midair because that felt more active and controlled. That is mistake number 4, poor arm position. Your arm must be supported at heart level. If the arm hangs too low, the reading can look falsely high. If the arm is raised too high, the reading can look falsely low. Gravity is part of this measurement whether people think about it or not. This is not about comfort alone. It's about basic physics. The cuff is estimating the pressure in your artery, and its job becomes less accurate when the artery is not positioned where the test assumes it is. Think about how often seniors measure on a couch, in bed, or in a recliner. Those places are comfortable, yes, but they often make proper arm support difficult. The result is a blood pressure log filled with numbers created by posture instead of physiology. That's a dangerous substitution if medications are being adjusted from that data. James corrected one thing. He sat at the kitchen table, rested his arm on a pillow so the cuff was level with the middle of his chest, and took the reading again. Suddenly, his home numbers made much more sense. If you want dependable results, use a chair with back support and a table or firm surface beside you. Your feet should be flat on the floor, your legs uncrossed, your back supported, and your arm relaxed. No dangling. No holding it up with muscle effort. Let the surface do the work. And speaking of posture, mistake number 3 lives right beside it. This is one of those errors people dismiss because it feels comfortable and familiar. They sit however they normally sit, then assume that comfort equals correctness. But comfort and accuracy are not the same thing. Mistake number 3 is poor body position, especially crossed legs, unsupported back, or feet not flat on the floor. These details sound tiny until you understand how quickly the body reacts when it has to hold itself in a strained position. Let me tell you about Nancy. Nancy always checked her pressure in her favorite high kitchen stool. She loved that spot because the light was good, the monitor stayed nearby, and she could keep an eye on everything happening in the house. But on that stool, her feet dangled. Her lower back had no support. Half the time, she crossed one leg over the other without even thinking about it. Her readings looked unpredictably high, and she assumed her blood pressure was just all over the place, in her words. What was actually all over the place was her positioning. When your legs are crossed, you can change blood flow enough to affect the reading. When your back isn't supported, your core muscles stay engaged to keep you upright. When your feet aren't planted, your posture becomes less stable and more effortful. These are not dramatic movements, but blood pressure doesn't require dramatic triggers to shift. It responds to the small demands your body is making in the moment. Seniors often underestimate that because the effort feels minor. The fix is wonderfully boring, and that's a good thing. Sit in a proper chair, back supported, both feet flat, legs uncrossed. Stay there quietly for the full measurement. Nancy switched from the stool to a dining chair and started taking readings in a much more controlled position. Her numbers became more consistent within days, not because she suddenly got healthier overnight, but because her measurement finally stopped fighting against her posture. Reliable technique often looks less impressive than people expect, but medicine loves boring consistency. There's another layer to all of this that people rarely appreciate. Blood pressure behaves differently across the day, which is why consistency matters so much. If you check one day before breakfast, the next day after coffee, and the next day after arguing with the cable company, the numbers cannot be compared fairly. They belong to different conditions. Seniors often think the body is becoming wildly unstable, when the bigger problem is that the testing circumstances keep changing. Same general time, same preparation, same chair, same sequence. Consistency turns scattered numbers into a story your doctor can actually understand and use. Now we're down to mistake number 2, And this one is a major reason so many seniors tell me my blood pressure is completely unpredictable. Sometimes it really is variable. Blood pressure naturally changes throughout the day, but often what people call unpredictable is actually incomplete data. Mistake number 2 is taking only one reading and treating it as the truth. One reading is a snapshot. That's all. It might reflect your typical pressure, or it might reflect a momentary blip caused by stress, anticipation, or simple measurement noise. Let me tell you about Robert. Robert was a retired engineer who loved numbers, but ironically, he trusted the very first number he saw every single time. If it flashed high, he spent the rest of the day upset. If it flashed normal, he relaxed completely. There was no second reading, no pause, no average, no effort to see whether that first number represented a pattern. He was handing enormous emotional power to a single data point. And for seniors, that can create a brutal cycle of reassurance and panic. When we changed Robert's routine, the chaos calmed down. He took one reading, waited a minute, then took a second. If those were meaningfully different, he took a third and focused on the average of the later numbers. What happened? The first reading was often the highest. Why? Because the first inflation itself can make people tense. They're watching, anticipating, wondering. Sometimes the body relaxes only after the first measurement proves there is no immediate crisis. The second or third reading may tell a much truer story. This doesn't mean you should measure obsessively 10 times in a row until you find a number you like. That's not helpful. That becomes number chasing, and number chasing can feed anxiety. But 2 readings, sometimes 3, 1 minute apart, is a sensible and widely recommended approach for home monitoring. It gives you a better sense of your actual range and helps smooth out random fluctuations. If you rely on a single reading, you risk making decisions from a number that was never stable enough to deserve your trust in the first place. And now we've reached mistake number 1, the most common error, the most underestimated error, and in many cases the one that quietly contaminates everything else. If this mistake is built into your routine, it doesn't matter how loyal you are about timing, logging, or repetition. The reading starts off flawed. Mistake number 1 is placing the cuff over clothing or over a rolled-up sleeve that squeezes the upper arm. I know, it sounds too simple, too ordinary, too small to matter. That's exactly why it fools so many people. Let me tell you about Louise. Louise did almost everything right. Same time every morning, quiet room, proper chair, careful notes, 2 readings. She was disciplined, thoughtful, and determined to help her doctor manage her blood pressure well. But her home readings stayed consistently higher than what we found in clinic. Not wildly higher, just high enough to keep prompting concern. When I asked her to show me her method, she rolled her long sleeve halfway up, wrapped the cuff above it, and smiled as if she were demonstrating perfect technique. That rolled sleeve was the culprit. When fabric bunches tightly above the cuff, it can act like a tourniquet around the upper arm. And if the cuff is placed over clothing, even thin clothing, the measurement is no longer being taken under the conditions the device expects. The machine isn't thinking, oh, that's just a soft sleeve. It's trying to detect subtle changes in pressure through layers and compression that do not belong there. The reading may come out higher, sometimes much higher, and you may never realize why, unless someone catches it. Louise repeated the measurement with the arm completely bare. No rolled sleeve, no fabric underneath, no constricting band of cloth above the cuff. And the number dropped immediately into a safer, calmer range. Imagine the consequences if that error went unrecognized for months or years. Medication could be increased unnecessarily. Fatigue could worsen. Dizziness could appear. Falls could happen. Or a senior could live in constant fear, believing every high reading is evidence that their body is failing when the real problem is simply the way the cuff is applied. So let me make this rule unforgettable. The cuff goes on bare skin, completely bare skin, not over a blouse, not over a pajama sleeve, not above a tightly rolled sweater cuff. If you wear long sleeves, remove the arm from the sleeve or change into something that leaves the upper arm free. It takes a few extra seconds, but those seconds protect the validity of the measurement. And once you understand how sensitive this process is, you stop seeing those seconds as inconvenience. You start seeing them as safety, because they are. Now that you know the 7 mistakes, I want to pull the whole picture together, because information only becomes powerful when it turns into a routine you can actually follow. Seniors do best with a repeatable system, not a complicated system, not a perfectionist system, but a dependable one. So here is the routine I want you to imagine for yourself. You wake up. You use the bathroom. You avoid rushing around. You do not drink caffeine, smoke, or exercise right before measuring. Then you sit quietly and let your body settle. You choose a proper chair with back support. Your feet are flat on the floor. Your legs stay uncrossed. Your arm rests on a table or firm pillow at heart level. The cuff is the right size and placed on bare skin. You do not talk. You do not scroll. You do not multitask. You take the first reading, wait about a minute, and take the second. If needed, you take a third. Then you record the numbers honestly without trying to edit the story they tell. That is useful home monitoring. And while we're talking about trust, let me give you one practical reminder that can save a lot of confusion. Make sure the cuff actually fits your arm. If it's too small, readings can look higher than they really are. If it's too large, the opposite can happen. Many people assume the cuff that came in the box must automatically be correct. Not always. Check the sizing guide. If you have a very small or larger upper arm, ask your pharmacist or clinician whether you need a different cuff. A well-made monitor with the wrong cuff can still mislead you badly, and that's frustratingly common. And please hear me on this point. Useful monitoring is not the same as anxious monitoring. Some people check their pressure every time they feel frustrated, tired, or mildly strange. That can create a trap. They begin measuring emotions, arguments, bad sleep, stressful news, or the normal fluctuations of being human, and then treating each number as a diagnosis. Home blood pressure monitoring should give clarity, not chaos. If it's turning into a ritual of fear, something about the technique, the timing, or the purpose needs to be reset. I also need to address the emotional side of this, because blood pressure has a strange power over people. They see one high reading and instantly imagine strokes, heart attacks, and disaster. Then anxiety drives the next reading even higher. That spiral is real. So when you monitor at home, try not to treat the machine like a judge handing down a verdict. Treat it like a thermometer gathering information. You are collecting clues, not sentences. Calm technique protects accuracy, and calm thinking protects perspective. Both matter. Both help you respond wisely instead of reacting impulsively to one scary screen. One of the healthiest habits you can build is consistency. Measure at the same times each day if your doctor has asked you to monitor regularly. Morning before medication and before breakfast is common. Evening before dinner is also common. Follow the plan you've been given. Write the numbers down or store them in a validated device. Bring that log to appointments. Patterns matter more than isolated readings. Trends matter more than emotional reactions. A single number can shout. A good log whispers the truth much more reliably over time. And one final reminder before we wrap this up. Never let one number define your day. Recheck it correctly, breathe, and look for patterns. Reliable health decisions are built on repeated truth, not on one moment in the kitchen. I also want to say something that doesn't get said enough to older adults. If you get one unexpectedly high reading, do not panic. Sit quietly. Check again after a minute or two. Review your technique. Ask yourself, did I just walk around? Did I talk? Is my bladder full? Is my arm supported? Is the cuff on bare skin? Many frightening readings become much less frightening when the method is corrected. On the other hand, if the numbers are severely high or you have symptoms like chest pain, weakness, or trouble speaking, seek urgent care. And if you are wondering whether your monitor itself is trustworthy, that's a fair question. Use an upper arm device, not a finger monitor, and be cautious with wrist devices unless your clinician specifically recommends one for you. Make sure the cuff size matches your arm. Bring the monitor to a medical appointment and compare it with office equipment when possible. A validated device plus good technique is a strong combination. A good device plus sloppy technique is still a bad measurement. The machine matters, yes, but the method matters just as much. Maybe more. Let me leave you with one more story, because stories make this real. Frank was 80 and proud of being independent. He handled his pills, his appointments, his meals, and his blood pressure checks without help. But he was making several of the mistakes we discussed. He rushed before measuring. He crossed his legs. He talked through the reading. Sometimes he placed the cuff over clothing. His numbers were so inconsistent that he started feeling betrayed by his own body. In reality, it wasn't his body betraying him. It was a flawed routine. We simplified everything. Same chair, same time. Bathroom first. 5 minutes of rest. Bare arm. Supported arm. No talking. 2 readings. Written log. Within 2 weeks, the noise began to disappear. His physician could finally see what his blood pressure was actually doing. That allowed smarter decisions and reduced a huge amount of fear. Frank told me something I'll never forget. He said, "Doctor, I thought I needed more medicine. What I really needed was better information." That sentence captures this entire video better than any chart ever could. Your blood pressure is too important to measure casually. It affects decisions about medication, stroke prevention, kidney protection, heart health, and long-term independence. And because high blood pressure often causes no symptoms at all, the numbers themselves carry a lot of weight. That's why they have to be as accurate as possible. Not perfect every second, not controlled obsessively, but measured correctly enough that you and your doctor can trust the picture developing over time. Accurate information is one of the most powerful forms of protection seniors have. So remember the 7 mistakes every senior must avoid. Don't measure before resting. Don't measure with a full bladder. Don't talk or fidget during the test. Don't let your arm drift away from heart level. Don't ignore posture. Don't trust only one reading. And never place the cuff over clothing or above a tight-rolled sleeve. Fix those 7 issues and you dramatically improve the odds that the number on the screen reflects reality instead of distortion. That is how you turn home monitoring from a source of confusion into a tool of confidence. If this video helped you, share it with someone who checks their blood pressure at home. A parent, a spouse, a sibling, a friend, anyone who deserves better information. And subscribe to this channel because my goal is to give you practical medical guidance in plain language, without confusion, without fluff, and without wasting your time. Your health deserves clarity, your decisions deserve trustworthy numbers, and you deserve the peace that comes from knowing you're measuring one of life's most important vital signs the right way. I will see you in the next video.